members of the media, wider viewing and listening public of Trinidad and Tobago, and also, most importantly, our nationals who are outside of Trinidad and Tobago who tune in religiously to hear what the government's position is and how we're dealing with your repatriation. I'd like to start off by letting you all know every single one of our nationals outside who has applied to come back, applied to the Ministry of National Security for exemptions and approvals to come back. We are working day and night assiduously. Up to midnight last night, I was on the phone with the Permanent Secretary at the Ministry of National Security, seeing how we could squeeze in a few more persons, and I'll explain the whole process to you all now and what is going on currently. So I want all of you nationals outside there to know that we are working assiduously and with all our effort to get you, each and every one of you, back home, and understand that there are persons who have applied for weeks, some a couple months now, waiting and hoping for that indication that they are next on the group of people to come back to Trinidad and Tobago. As you've heard, we've already granted, and this increased the figure as of Saturday gone, 4,515 exemptions were granted, and we continue to work. The main reason people at Trinidad and Tobago continue so far to avoid what we just heard Dr. Parasaram talk about, which is the local spread in Trinidad and Tobago at this stage, is due to the closure of the borders. All of our recent cases of positive COVID-19 have been re-importation and imported cases back into Trinidad and Tobago. But that is not stopping the government from doing all that it can to get all of our nationals back. As you are aware, we require every national who returns to be quarantined. That is part of the process. That is how we're managing our borders. And as we've said repeatedly, what happens is you need to balance it with our facilities, the public health sector's capacity and ability to quarantine persons, always with the risk that if there are positive cases and God forbid a spread in a group of persons coming back, that our parallel healthcare system that was so carefully built out is not overrun. We are doing everything possible to protect the 1.4 million people in Trinidad and Tobago from community spread. When you look at international news, and not so far from Trinidad and Tobago, a 3.5-hour flight to Florida. Florida is now the epicenter of spread in the United States. They now have the highest daily rate of positive COVID cases in the world right now. And this is what we're trying to avoid happening in Trinidad and Tobago by a very careful management of the numbers of persons returning at any given point in time. The availability of persons being able to be brought back in depends on our ability to supervise and monitor persons. We have two sets of quarantine set up: state quarantine for those that the state will fully pay for their quarantine period and whilst they're in quarantine, and we've expanded now our state supervised quarantine facilities. The state quarantine facilities, as you're aware, but it's worth repeating, are the Debe UE campus, Tacarigua, Sandy Grande, home of football, and Balandra. We have expanded our state supervised quarantine for persons who are willing to pay for quarantine. But again, the numbers are limited because remember, we need to have our nurses and our doctors present to make sure people are being properly quarantined. If anybody presents any symptoms, presents any illnesses, also in some of these facilities and the numbers that you just heard Dr. Parasaram refer to, we have persons who've returned from cancer treatment, cancer survivors, low immunity rates in some of these state supervised quarantine at Cascadia and Chancellor, and we're managing that. We've added now the Regent Star, which is up at Piarco, to give us more capacity to offer more people the opportunity to get on those flights to come back home. Just to let you all know what is currently going on. As you all are aware, we've brought back people from Mexico, Venezuela, Guyana, Suriname, Barbados, other Caribbean islands, and persons on cruise ships, the UE students in Barbados, Jamaica, also rig workers, oil and gas workers in the thousands, and we continue to manage it. And so far, fortunately, and I want to give a lot of thanks to all of the Ministry of Health personnel who have effectively managed the quarantine and return of these thousands of persons, still without there being community spread of COVID-19 in Trinidad and Tobago. And we should never underestimate or lose sight of that. So I thank all of them, applaud them for the months of hard work, as well as the Ministry of National Security personnel who secure these facilities. Today, 15th of July, at 4:20 p.m., so this afternoon at 4:20 p.m., we have 76 nationals returning from Grenada. 76 nationals. Out of those 76 nationals, only 4 are going to state-supervised quarantine facilities. So immediately you see that 72 nationals returning today go immediately into the state quarantine facilities at Debe and Tacarigua. So immediately those 2 facilities are up to capacity. Out of that, there are 25 students, 10 faculty members, so 35 who are studying or associated with studying in Grenada. On Friday, the 17th of July, we have worked with Caribbean Airlines to do a repatriation flight from Canada. Of course, we can't bring everyone back on the first flight. So what we had to do is go through the list, persons who applied a long time ago. Understand there were some people who went abroad for a 1-week vacation and then got caught outside there. There are others who are now finding themselves in more trying circumstances. How do you balance that list? How do you balance the person who went out for 2 weeks, ended up having a baby out there, has postpartum issues now and is suffering from depression, with someone who now runs to the media to claim, I need to come home immediately? That is not a fair process. So whilst I understand the anxiety, we as the government understand the anxiety, the frustration of persons who run to the media and highlight their personal issue to the detriment of others who have been waiting patiently, who have abided by the rules, who have waited, who are messaging us, who are emailing us, and we're in correspondence with them. Those are the difficulties, and that's not something we can encourage, because it certainly is not fair for a person who took a decision to go to visit family last year, to spend months when they saw what was going on with COVID. They decided to stay with their family. The borders closed, and now they're rushing to the media to put the pressure, as opposed to somebody who may have gone for work-related issues or gone to shop for, and these are real cases, gone to shop for baby clothes, got stuck there, had their baby outside of Trinidad and Tobago, have run out of funds, and are now. So is it that they are doing what they can? They're agreeing with the government's position that they will get back here as soon as they can, and because they haven't run to the media, these are the difficulties. Do they get now pushed down the queue, the line, even though they put in their exemption on the 24th of March, compared to someone who put in their exemption sometime in June and is utilizing certain outlets to try and pressure everybody else in the queue? Because it's not pressuring the government. We are adamant that we're bringing everybody home. On Friday, we will be bringing back 71 individuals from Canada. So you add that to the 76, that is immediately up to 147. Out of the 71 people coming back on Friday from Canada, only 19 are utilizing the state-supervised quarantine. So now we're offering, when we give people the approval, we're saying, please indicate to us whether you would be willing to pay for state-supervised quarantine at a hotel. Some families have taken up that offer, so it allows us now to bring back other people into the state quarantine facilities. But out of 71 approvals and exemptions granted for Friday, for the first flight, and there will be further flights from Canada, Caribbean Airlines flight working with us, only 19 individuals, and most of those are family members. So a father, a mother, and 3 children are going into the state supervised quarantine. So that means we need room for 52 individuals. They are going to the home of football. So again, another quarantine facility is up to full capacity, because now you can't mix persons. You have the groups coming back from Canada. We can't mix persons from the United States with them because they're different risk profiles, and you don't want to increase the risk of persons contracting COVID whilst in quarantine. We have also granted, to date, approximately 80 approvals for persons in the United Kingdom, mainland Europe, and the Middle East, who we expect to be coming home in the next week and a half. So you have 76 today from Grenada, on Friday 71 from Canada, and then 80 approvals granted from the United Kingdom, Europe, and the Middle East. So doing those math, you immediately see that our state quarantine facilities are up to capacity at the current time. And we're hoping now, in between there, what you all need to be aware of, there are some instances where you may have an air ambulance coming in, you may have other persons coming in. So in our miscellaneous category, We have some workers, you all will recall some workers who were working down in Suriname, decided not to come home when we were expatriating people back from Suriname, and now they are also being let in. Some workers from Suriname and Guyana, a total of 12. Then you have some other persons with medical issues and other issues who've been right there on our doorstep. And when we start to add those up, that's another 9. Then we have the students from India and 2 cruise ship workers who are out in Europe, in the United Kingdom. And that's 7 there in total. And then we have persons who are coming in for emergency repair work on some of our energy platforms, some of our manufacturing platforms, because our local manufacturers are asking for foreign workers to come in to upkeep their equipment. We don't want manufacturing. We've kept our energy sector going to drop at all, so they too, in little sparse amounts, are coming in as well. So that totals right there over 35 persons as well. So when we add all of these numbers, we are now up to full capacity. It is not stopping us. We are now looking, and I'm working closely with Ministry of National Security, is working closely with Caribbean Airlines, because we are aware that we have a lot of nationals who now need to leave Trinidad and Tobago and go back up to the United States, or students, for example. So we are looking at working with CAL to get some flights from Trinidad and Tobago back up to the United States that would assist students who then have to go on to school. Fortunately, we saw the US government back down from a position they'd taken earlier that had created a whole set of anxiety in our parents, understandably, where the US government said if your classes are online, you have to leave immediately. That situation now, thankfully, the United States government has retracted from that, so those students are not at risk. Though we are now going to be planning with Caribbean Airlines some flights to take persons out and, of course, to repatriate people. But as I've just tried very carefully to explain, right now our state quarantine facilities are at maximum capacity. And those are 14-day cycles. Of course, the risk is, if there is, God forbid, an outbreak or some positive spread in that, you then have to, when you decant the facilities and everybody finally gets home safely and are tested negative, according to our public health experts, we then have to air out the facilities. But what we're doing is we're looking at, I'm going to be working with the Ministry of Health, National Security, to see if we can identify some other hotels that are outside of the way, that are not around populations and residents, that we can increase our state supervised quarantine facilities to now offer more of that, especially as we want to start bringing back persons from the United States. So the message is, we are working hard to get everyone back. We will get everyone back. Right now, there are no commercial flights being allowed into Trinidad and Tobago for the exact reasons we've stated. But we are getting to the United States as the next category. Understand these numbers from Canada, United Kingdom, Europe. That's not everybody who's there. So these are the first repatriation flights. But what we're doing is we're trying to make sure we're as fair as possible. We have students who are writing us from Colombia who are trapped there. We're trying our best. But the United States is our next area of focus. The students who are in Trinidad that need to get out, we are aware of it. We know the timing of schools, and we're working with CAL to put on the flights to get you all back up to the United States and Canada where you need to be, and to turn those flights around into repatriation flights. But in deciding who it is that will be on those repatriation flights, it is coming down to, as one category, those who applied earlier clock. Not those who are applying now, later on, because we do have instances of persons who were making their lives and living in Canada, in the United States, and now for whatever reason they want to come back to Trinidad and Tobago. It's not fair for those persons to jump a queue of persons who just went out for a visit and are stuck outside there. What I'd also like to say is, in discussions with the Prime Minister this morning, a decision has been taken, and he's going to be asking the Minister of Finance to send certain sums of money to our consulates or missions or embassies in the United Kingdom, Canada, and the United States to try and assist how we can. Now, it's going to be limited sums of money sent to the most needy cases and the most legitimate of cases. I will be working with those various consulates, embassies, and missions using the lists of requests for exemptions that we have at National Security to try and identify those who may need when they come to those embassies, missions, and consulates asking for help, it is a very difficult exercise. And we expect that there may be some who would try to abuse the system, but we're going to do the best we can. So we are, as a government, taking a decision to send some funds to those various consulates, embassies, and missions to try and assist some of our more needy nationals who are outside there. Not the ones who are living and carrying on their lives outside in these countries, but those who went on short visits and have now found themselves in difficult circumstances that we are very aware of. It is a difficult system, but it is a fair system that we're operating. CAL is not running scheduled flights. We will continue to work with Caribbean Airlines to see how we can do some pickup flights, as we call it, some repatriation flights, and we will make those announcements as and when they happen. When we send out the approvals, we're asking people to please indicate whether you're prepared to pay. Now, there were a lot of people who said, yes, they will pay. And then when we wrote to them, of course, they're saying they need to go into state quarantine facilities. So that's why I gave you the numbers. So 71 persons in Canada granted exemption. Only 19, quite a few of which are families, are using the state supervised, i.e. the paid for quarantine system. So even when people are saying they're prepared to pay for quarantine, and we don't expect them to, it's an option. Even when they say they're prepared to do that, when you start to crunch the numbers, unfortunately it hasn't worked out, but we are looking at expanding our facilities and the ability with Ministry of Health to quarantine more persons so we can bring in more flights. I just want to stick a pin that right now the United States is the largest number of applications we have, running in the thousands. Unfortunately as well, United States is now the epicenter globally of positive COVID cases, and the areas where we're looking at a lot of our nationals in Florida, for example, that is now the epicenter globally, producing the most cases. Also in Texas, family in Texas. The Prime Minister has told us about family in New York, his daughter in New York. It is not an easy situation, and don't think that we are not aware of how difficult it is. But we are the ones who are tasked with the responsibility of applying a fair process to all of our nationals who are looking to come home and getting them home, and we will get it done. Be assured that we will get it done. Unfortunately, due to the cycle of this virus, COVID-19, there's a 14-day period that we're running through. There are record-breaking health issues in the United States. We will continue on working on bringing you all back. But the quarantine has been used, and it has been proven to be very effective in protecting the people in Trinidad and Tobago. The United States is now suffering, and that is where the risk is greatest. So we need to be cautious and not squander all of the good work that you, the population, have done by listening to our health experts and the scientific evidence and the scientific advice that has gotten us this far. Please be assured that we are not sleeping, and we're working as hard as we can to ensure we get all of our nationals back in the shortest possible time frame, but balancing our quarantine facilities and ensuring that we don't jeopardize or risk the population that is in Trinidad and Tobago. Minister Cox, thank you very much.
Thank you very much, Minister. Members of the media, the floor is now open to remember to identify